When you have epilepsy or any kind of seizure condition, memory loss and memory recall is oftentimes greatly affected. And it's kind of a twofold situation because not only is it affected for the way that epilepsy slash the seizures impact the brain, but also it's impacted by any sort of anti-epileptic that you may be taking to combat the seizures. And any kind of seizure has the potential risk to affect your memory prior to the seizure, during the seizure, of course, and after the seizure. The effects could be much longer lasting. Generalized seizures affect all parts of the brain, focal seizures affecting parts of the brain, and those who have both, it affects the whole brain. I am one of the lucky individuals who has both, where it affects the whole brain. And abnormalities in the temporal or frontal lobes of the brain are the most common reason for memory problems in people with epilepsy, but memory problems can happen in all types of epilepsy. And I definitely experience this, especially during times of great stress or being triggered. My memory recall, even for trying to find the correct words or verbiage when I'm having a conversation, can bring a lot of difficulties where it feels like I'm searching so deep within my brain just to maintain a normal level of conversation. And to the other person, it seems kind of strange. And the types of memory problems you'll have depend on the cause of your seizures and the part of your brain that's affected. People with temporal epilepsy, for example, have difficulty taking in new information, versus frontal lobe epilepsy may make it difficult to recall events from the past. However, all kinds of memory difficulties can occur in all kinds of epilepsy. It just depends on how the epilepsy affects you. And this is something to note and really know that it's not a you problem, but it is an epilepsy seizure problem as to why the memory is so affected. And so, to not be so hard on yourself, as this is just a part of you and kind of the way it is, and to not put so much blame and shame. And of course, the medication, as I had said earlier, affects memory. So memory difficulties can happen due to the side effects of the anti-seizure medication. So drowsiness, concentration problems, it affects short-term memory, and it makes it difficult taking in new information. So not only at a baseline without the medication is this affected, with the medication too, although it can minimize the seizures, it impacts memory as well. Sometimes the way that the seizure medicine stops seizures also can affect how the brain works in other ways, as stated from this article below. Since seizure medicines lower the excitability of nerve cells in the brain, they can also affect normal activity. So cognitive problems, problems with thinking, remembering, pay attention, or concentrating, finding the right words, which is what I had mentioned earlier, or other symptoms can be due to the side effects of some seizure medicines. And again, I notice this more significantly when I'm under a great amount of emotional, physical stress, whatever it may be. And there are obviously various mechanisms and ways of going about things to try to improve memory recall. I think number one, though, is to try to not shame yourself or blame yourself for this. It is genuinely a part of our brain and something we really can't change. We can just try to adapt and work with it to the best of our abilities. Like, I constantly have ongoing lists, I have multiple calendars, I have various things to trigger my memory cues in order to maintain a stable sense of time. But that combined also with PTSD and other mental health going on, like, my memory is honestly horrible, but I do the best I can to maintain a consistent timeline. And that's all I can ask for myself. If you also experience these gaps in memory or difficulty with memory recall regarding words and things like that, just try to remember it really isn't your fault and you're doing the best you can. And try your best to give yourself compassion and to not shame. The brain is so powerful, and it is truly, to those degrees, out of our hands to control. So if those around you are also shaming you for your memory recall, loss of memory, when you are struggling with seizures or epilepsy, those people are not your people, because it genuinely is part of the disability. I'm going to get more into the methods of improving memory recall and the different things you can do to improve on this next time. Everything will be okay, and you got